A brain tumor occurs when the cells inside the brain start growing at an abnormal speed, which forms a mass of abnormal cells in the brain. The enclosed space inside the skull is limited, and when these abnormal cells start closing in the space, the symptoms are observed.
World Brain Tumor Day is observed on June 8 every year to raise awareness and educate people about the brain tumors. There's no description of a brain tumor in the Asian medical text, but there's a recurrent mention of skull trepanation, surgical intervened borehole into the human skull to relieve the symptoms of a brain tumor.
Right. Okay, so Health Talks, one of the, But Chika Okwesi is the Executive Director of Brain and Spine Foundation Africa, and she joins us live this morning to discuss more on the World Brain Tumor Day and also how survivors, manage with this health challenge. So good thing there is hope, there are survivors, but explain to us in a bit of realistic terms what brain tumor is all about.
Thank you for having me. I'm so honored to be here this morning. You have just described what brain tumor is in a simplest form. Brain tumor occurs when the cells in the brain start growing in an abnormal speed, forming a mass of abnormal tissue inside the brain. World Brain Tumor Day is observed every year on the June 8th all over the world to raise awareness on brain tumor and also to support people who are affected with brain tumor. Brain tumor is one of the most debilitating diseases of the brain, and it has two types. One is benign, that is primary brain tumor, or one is benign, one is malignant. It can be benign or malignant, and also it's classified in different forms too. Brain tumor can be it's classified based on the location, the cells that forms the brain tumor, and also the size of the brain tumor. Brain tumor affects a lot of people, but due to lack of awareness, especially in sub-Saharan Africa, Nigeria included, people don't get to get diagnosis on time. So late diagnosis don't help a lot of patients in recovery and also in the treatment. Considering the fact that brain tumor is also expensive to treat. So poverty, lack of resources also do not help a lot of patients. Brain and Spine Foundation Africa was founded in 2017 after a first-hand harrowing experience of a brain event that happened to my younger sister.
Okay, so I really wanted you to talk about that because I know you have a first-hand experience of what it is, what this is all about. So just tell us from a survivor point of view.
Okay.
How do you think this initiative can help somebody who has a brain tumor? But first, I know you have a story to tell. Tell us how this helped you.
How it has helped me?
From your story, from your personal story.
From a personal story,
yes.
From a survival point of view.
Okay, I am not the one that
I know. I
was a caregiver.
Yes, so from somebody
survivor.
Okay.
The person that I helped did not suffer brain tumor.
Okay.
But I have helped a lot of brain tumor patients and survivors. Yeah. Some of them have also died. Some survived. Some are still recuperating. So brain tumor impacts the patient in a very in numerous ways. And it's not just the person, the individual patient, that the brain tumor can impact negatively. Family, the caregivers, the whole community, you know, they all have the suffering of the person that is having the brain tumor affects everyone in a very negative way, because they all have to
endure the suffering.
Endure the suffering together.
Yeah.
Do you get? So it's not an easy disease to overcome. It's not an easy disease to treat in this side of the world because of lack of awareness. So we are trying to see how to create awareness and encourage early detection and early treatment.
All right. So, but you know, you were going to tell us about your sister. So even though you said she didn't have brain tumor, but what was that experience of hers that now kind of helped you to come up with this for brain and spine patients?
Okay, like I was just trying to say initially, yes. Brain and Spine Foundation was established after a first-hand harrowing experience. And it was the time that my sister suffered a brain hemorrhage. And I was thrown into the space, not knowing what to do. In the course of taking care of her, I had to discover that there was this darkness when it comes to our neurological health, when it comes to brain and spine. People do not understand the diseases, how it comes. Anything that has to do with brain, most of the times are misunderstood to be spiritually related or culturally related. So I noticed that a lot of people are suffering from those cultural limitations, and I decided that it was time to do something. That was why Brain and Spine Foundation Africa was established, to advance, first of all, support the government in advancing the neurological health care, then enhancing the quality of lives of individuals who are affected by neurological conditions. So today is World Brain Awareness, World Brain Tumor Day, and we felt that it's also important in our community. We have a lot of survivors and also some patients who are also awaiting treatment, but because of lack of resources, they are still there waiting without the treatment that they need.
All right, so you've seen a lot, you know, with taking care of your sister who didn't have brain tumor but brain hemorrhage, and I would have actually loved you to break down what hemorrhage is. I mean, the difference between it and tumor. But then also in starting up Brain and Spine Africa, you've also come across a lot of people. You said some have survived, some are still in the process, some have died also. But can you tell us, you know, what one encouraging thing that someone out there who probably was just diagnosed could learn about a possibility of living through brain tumor, surviving and living beyond the survival? Because sometimes managing life after these major illnesses is not really easy.
And how family can be able to support such person?
Yes, like I said, when somebody is have diagnosis of brain tumor, it comes with a lot of sadness, anger, confusion,
despair.
Why me? Some questions. But there is hope, because people have survived. People are living with the deficits too. Some neurological deficits that come with it. So what the person that has diagnosis first has to do is make sure that the person gets back on seat, relax, ask questions. Where do I start? Like, for example, it's so easy for a lot of Nigerians to always conclude that there is no cure or that there is no remedy. Even in Nigeria, there are neurosurgeons, there are hospitals that can help. But you've oftentimes see them concluding and rushing to India. Sometimes they get there and they get stuck, and also do maybe partial treatment and still come back to meet some neurosurgeons here in Nigeria. So when somebody has a diagnosis of brain tumor, that is first step, that at least you have the diagnosis of of the tumor. Then the second thing you have to do is make sure that you ask questions. Where will I get the treatment? How, is there any support group around? People that have gone through what I'm about to go through? Is there any help around? If people that have maybe monetary problems, they can ask for help from people, because oftentimes one family can't afford to shoulder the cost of these diseases of the brain. It's very, very, it can be overwhelming, for people that don't have a good insurance, health insurance, which most of us here suffer from.
Wow. Thank you.
Right.
Serious. It's too much to handle.
Well, definitely. I mean, one thing you've done is to give maybe hope to someone out there that you can actually reach out and ask for help. Because one of the problems people have also is when there is a major diagnosis of such, terminal diseases, they just tend to want to soak it in, keep to themselves, and wait out their time, even when the person could actually, be saved. And like you said, brain tumor, you even start by determining whether it's benign or malignant. So maybe it's not even malignant yet, and then you wait it out till it gets, to the point where you want. So thank you for coming to share this experience with us this morning, and to give a message of hope to someone out there that ask questions, reach out. Maybe there's some trust fund you don't know about, or some support group that can help to raise funds. So thank you.
Thank you very much for that.
It's my pleasure. Thank you.
Now let's go to headline news.
President Bola Ahmed Tinubu says his administration is committed to infrastructure development and urban renewal. He reaffirmed this commitment while commissioning the completion of roads B6, B12 and Sako Road in Abuja, which has been opened up to boost the economy of the nation's capital. I don't know who else is as happy as I am about this road projects.
I'm very happy. The presidency has denied that the Minister of Finance and Coordinating Minister of the Economy, Wale Edun, has proposed 105,000 naira in the minimum wage template.
Okay, so we're getting somewhere definitely.
Of course.
Yeah, and the airline operators of Nigeria have opposed the $300 helicopter landing and takeoff fee, which was proposed to be implemented by the federal government, insisting that it must be permanently scrapped.
And freight services have resumed on the 1,132-kilometer corridor hold Lagos-Kano narrow gauge